We have more experience using live cell-based structures than anybody else in the world in the oral environment. And so we're going to look at all of these different areas, and we're going to develop some decision-making support systems to help you kind of sort through when might these be a reasonable alternative to autogenous tissue.
It's our job to know what's out there. Really, what does the evidence support it?
What are the things we need to look at? What are the defect factors that will control the outcome?
The change in trajectory towards regeneration versus repair. These are all important things to know from a scientific basis.
Practice-based research allows us to be able to produce studies that are going to be more translatable to your practice. You have to demonstrate how you will generate real-world evidence.
In our research center, we've kind of looked at all of these things collectively over time with different applications. It's a great course to be able to put your hands on instrumentation and materials and have someone over your shoulder guiding you on what we do clinically on a day in, day out strategy.
I don't think anybody has done more than we have in looking at alternatives in a methodical way.
This is something we live by when we start adding different factors to the mix to get our outcomes. Understanding patients, their expectations, super important here.
We're doing it this way because we started these studies 20 plus years ago.
We want to think about how we can make their life easier.